friends, thank you for joining us for this webinar on driving organizational change initiatives through remote learning. This webinar is brought to you by Midmark Corporation and Harbinger Interactive Learning. My name is Rahul. I work for Harbinger Interactive Learning and I'll be your host for today. We also have Isha from Harbinger Interactive Learning with us, and she'll be our co-host for today. So before we get started, here are some quick housekeeping tips. If you cannot hear the audio, ensure you have selected the right speaker for audio output. You might want to test your speaker to ensure it is working fine from the audio settings option. If necessary, dial in using phone. The dial-in numbers would be available in the webinar registration invitation email that you might have received. We want this to be an interactive webinar session. So at any point of time during the webinar, if you have any thoughts, questions, comments, please type in the chat window, or you can also use the Q&A panel for typing in your questions. Isha and I will moderate the chat and the questions, and we'll try to attend to all the comments and questions during the session. If due to time constraints, if there are any unanswered questions, during the session, we shall follow up via email and provide the answers for the same. And once the event is done, the webinar is done, a recording will be made available to all the attendees and all the other people who have registered for the event within a couple of days. And now it's time to meet our first speaker for the day. Good morning, Cleon. Thank you for taking the time out to present on this webinar today.
Thank you, Rahul. It's my pleasure to be here.
Cleon, to start with, could you please help the audience know you a little better? Could you briefly tell us about yourself?
Sure, be glad to. My name is Cleon Wellington, and I serve as the Director of Professional Education for Midmark. I have experience in technology, healthcare, and corporate and higher education. Some of my past positions have been at Care Innovations, where I served as a Director of Customer Operations, a Program Executive, and a Market Development Manager. My job roles when I was at Intel included Field and Outreach Education Manager for the Digital Health Group and Strategic Programs Manager for Intel University. And I like learning, so I also hold a Master's of Science in Information and Communication Sciences, a Master's of Science in Education, Instructional Systems Technology, and a Bachelor of Arts in Communications and Theater Arts. My professional passion is interactive adult education.
Thank you very much, Cleon. Thank you for sharing these details with us. And now may I request you to tell us a little bit about Midmark Corporation as an organization, who you are, what you do.
Absolutely, Rahul. Midmark Corporation is headquartered in Ohio. We are the only clinical environmental design company that enables a better care experience at the point of care in medical, dental, and animal health. Our unique approach to designing all of our products and solutions revolves around a single idea: harmonizing space, technology, and workflows to enhance interactions between patients and caregivers. We are primarily known as a medical device and equipment manufacturer with products ranging from exam tables and chairs, to cabinetry, to x-ray, to diagnostic devices, to dental equipment for both humans and animals.
Thank you. Thank you very much, Cleon, for sharing this information. This sounds very interesting and a pretty diverse portfolio. Thank you once again for taking the time out on this webinar. So with that, now let us take a moment to welcome our second speaker for the day. We have Darshan with us from Harbinger Interactive Learning. Good morning, Darshan. How are you doing today?
Good morning, Rahul. I'm doing fine.
Wonderful. That's great. Darshan, I'm going to make the same set of requests which I made to Cleon. Our audience, could you please tell us something about yourself, and then also briefly about Harbinger Interactive Learning as an organization?
Sure, Rahul. So I currently work as General Manager at Harbinger Interactive Learning. My current role involves consulting trainers and L&D professionals from life sciences industry. I have experience in strategy building coupled with insights into market scenarios and customer challenges. And professionally, I'm passionate about driving customer value by suggesting them outcome-driven solutions. My education includes MBA in marketing and IT and a bachelor's degree in commerce. Now, briefly about Harbinger Interactive Learning. So Harbinger Interactive Learning is a global design and development company specializing in helping organizations migrate their classroom-based training into virtual and digital formats. Harbinger Interactive Learning has over 30 years of experience in delivering innovative learning solutions for various industry verticals.
Thank you, Darshan. Thank you very much for sharing all this. And once again, thank you for taking the time out to be on this webinar. This sure is going to be an exciting event. So before we take a deep dive in today's topic, which is about driving organizational change initiatives through remote learning, let's take a quick audience poll. And the objective is to get some sense in terms of, if given a business opportunity or if given an opportunity, what are some of the key business objectives that we would like to achieve through remote learning? And the poll should be coming up on your screen now, anytime. Right, so the on your screen, and we have multiple options. You can select more than one option. And the options that we have are, option one is business continuity for customer delight. Second one, keeping employees engaged and productive during remote working. Third is about bringing in behavioral changes in your learners to meet the desired business objectives. And the fourth one is sustaining the culture of an organization by reinforcing values. And we see some responses coming in. Thank you very much for the active participation. 71% people, or 71% of the audience have voted till now. We'll keep this open for another 10 seconds or so. So please feel free to select your options, choose your options. All right, so we'll end the poll now. Okay, so this is interesting. In fact, 68% people have voted that the key business objective that they would like to achieve is bringing in behavioral changes in their learners. That's interesting. And the second one is keeping employees engaged and productive while they are working remotely. That's 53%. So 68 and 53%, these are the top two contenders. And then the other two follow up with 26% each of votes. So once again, thank you very much for actively participating in this. This gives us a good idea, good insights. So as we all know, with the current pandemic situation throughout the world, there has been some significant changes that are happening around us. Humanitarian, economic, and psychological demands on our society and businesses have changed. And one of the important business needs for organizations during these times is to create a sustainable and scalable learning ecosystem for the ever-evolving workplace. Now, it's not just the workplace which is evolving, but at the same time, the role of L&D leaders is also evolving very fast. No longer the L&D can afford to work in silos, and we have to collaborate. We have to, collaborate with multiple functions within a business. So we as L&D leaders are the catalyst for this change. So we are driving this change. And one of the key jobs that we have on our hands is to keep our remote workforce engaged by bringing learning in the flow of their remote work. And what this has done is this has raised kind of, new mandates for the CLO and the L&D leaders. And if we had to broadly categorize, these are the 4 categories under which they could fall. And we saw that in the audience poll. Changing behaviors, employee engagement were the top 2 drivers, followed by customer delight and sustaining culture. Having said that, now let me turn to Darshan and request for some insights as to what the L&D leaders are looking to achieve in the life sciences industry through the implementation of remote learning.
Well, Rahul, the conversation that I have been having are throwing up various insights. But if I had to summarize them, it will boil down to these 3 key objectives. 1, scalable remote learning solution to support a diversified and a global workforce. 2, providing continuous support in the flow of remote work. And 3, the ability to create a measurable business impact.
Thank you very much, Darshan, for summarizing and giving us these insights. Now let me turn to Cleon and request for his insights as to what does remote learning means at Midmark Corporation. Cleon, please, if you could share some of your thoughts.
Sure, Arul. Helping our teammates and clinical customers learn new information and change behavior for business outcomes is the ultimate purpose of our professional education department. As you mentioned, like most customers and companies, our sales teammates are not all in one location. They are spread across North America. We have 10 offices and manufacturing locations in the United States, as well as in Italy and India. Seldom are large groups of our people together in the same place at the same time. We need to keep up with and address the speed with which the industry, customer needs, and products change. To do that, we must deliver the right content to the right person at the right time in the way that they want it. This requires delivering remote learning in a variety of modalities. Remote learning also reduces the non-customer downtime of travel as well as costs. Today, most learning does not occur within a classroom setting as many of us grew up with. People learn in many ways, such as text messaging, YouTube videos, reading articles on the internet, and asking their friends and coworkers for advice and ideas, all remotely. All this leads back to delivering the right content to the right person at the right time in the way they want it to improve business outcomes.
Well, you rightly said, Cleon, and thank you very much for summarizing this. I think somewhere in while you were mentioning the definition of remote learning kind of came out. It's not just about one particular type of training modality, not a classroom training or not a self-paced learning, but it's more about these various modalities. Even a text message could be a learning opportunity while we are working remotely. So thank you. Now we understand what remote learning means at Midmark. So now it brings us to the important question in terms of what was the change initiative that you and your team were trying to achieve at your organization at Midmark Corporation through implementation of remote learning methodologies?
All right, it was an important change initiative for our company. As a 105-year-old privately owned company, Midmark has been through many transformations in its lifetime. We are currently expanding our focus from products to providing seamless solutions that improve the experience between the patient and the caregiver. We believe that who is using our technology is every bit as important as how and why it is being used. To help accomplish that, one area of focus of the professional education department is to help our sales teammates understand the clinical and patient experience and how our products help improve patient outcomes.
This is very interesting, Cleon. But at the same time, like any other change initiative, this also sounds like a daunting task. And I think the audience would be very interested in knowing as to how you and your team went about bringing in this change.
All right, let me tell you about it. It was done through a blended learning program. The program had various components, some of which were remote and others that were done in person.
Interesting. So the components which were done in person, could those be handled in the current situation when we are trying to implement remote learning solutions for our workforce?
Absolutely. If you would like me to take a deep dive into all these components, I will show some of the components, what were done in person, and how they can be handled via remote learning solutions.
That would be really great, Leon.
All right. So first, we sent an introductory video by our Chief Medical Officer, Dr. Tom Sweeterman. This was to explain why Midmark is making a focus on COPD and spirometry. We followed that with a What is COPD e-learning module. This module provided an overview of what causes COPD, profiles of people with COPD, and Midmark's solution set. One of our learnings was to allow more time between modules for learners to fit them into their schedules. At our annual commercial summit earlier this year, Dr. Tom gave a live presentation on the need to address COPD as a company. This was to reiterate the importance to patients of Midmark addressing COPD. We had posters on the walls around the presentation room with key facts about COPD as well. And Dr. Tom's presentation could be done via a webinar. And then we brought on stage 2 patients with stage 4 COPD to hold a Q&A session with the audience. We had previously made a video of the patients telling their stories that was shown before we brought them on stage. This also could have been streamed remotely, and the Q&A session could have been held online. We then had the teammates rotate through hands-on spirometry testing sessions where they learned to use the spirometry equipment and take tests on themselves. This could be done remotely via a webinar and with individual coaching, as the key sales teammates have their own spirometry devices as part of their sales kit. Then finally, over the last few weeks, we provided 4 day in the life of a patient with COPD gamification modules, where the learner became the module avatar and had to make decisions on how to deal with the impact of COPD in daily life activities. These were produced by Harbinger. The 4 topics were having a flare-up while doing normal activities. This we delivered at the conference. However, we found that while it was only 5 to 7 minutes in length, many learners waited until after they got home to review it. Then we delivered 3 more modules over the course of a few weeks, one about every 2 weeks. They were the stigma of having COPD, the responsibility to take care of yourself, and options to keep healthy. We used the Agile Scrum process where we delivered a module before we did the production on the next module, so we could take the learnings from each module into the next one.
Thank you, Cleon, for sharing these details of what the various components were in the blended learning program. And also, it seems interesting that some of the components which were designed for in-person activities could be done via remote learning options. For example, you mentioned that the live presentation by Dr. Tom at the annual commercial summit, that could be done as a webinar, as a recorded webinar, or probably as a live webinar solution as well. And the live Q&A session with the 2 COPD patients, that could also be, could be as an interactive video or a scenario-based video. So this is
absolutely.
This is very interesting, and thank you for detailing this out. Right. So now it's time for us to take another audience poll, and we'll launch the poll in a second here. And so the question is, which one of these training modalities have you implemented in the recent past to meet your organizational remote learning needs? And we'll launch the poll now. It should be coming up on your screens any moment from now. Yeah, it should be up on our screens now. And again, this is a multiple choice question. You have multiple options, and you can select multiple options, more than one options. The options that we have are talking head video, live webinar sessions, learning modules, e-learning modules, and then game-based learning modules. All right, so we have exactly 50% people, audience have voted till now. Thank you very much for the active participation. We still have time to go, another 10 to 15 odd seconds. So please feel free to vote. And if there's something different that you have done, please feel free to type in the chat window and we'll see what is it that you have done differently. All right, so we'll end the poll now and let's see what the results tell us. Right, so e-learning modules is something which 71% people have opted for, followed by live webinar sessions, which is 62%. 43% people have voted for game-based e-learning modules, and talking head videos, 29%. All right, so thank you very much. So it seems that, you know, we have used either one of these options sometime or the other in terms of, you know, implementing remote learning solutions to meet business objectives. Okay. So now let's moving ahead. Let me turn back to Cleon and try and understand as to why was the COPD and spirometry evaluation chosen as the topic to be addressed?
And that's an excellent question. Why COPD? Well, COPD is the third leading disease cause of death in the United States. There are over 160,000 COPD related deaths in the United States every year. It's estimated there are 12 to 14 million people in the US with COPD that are undiagnosed. And spirometry is the most effective and common method for diagnosing COPD. Only about half of primary care offices have spirometry test equipment, and if they do, they may not know how to get it into their workflow or interpret the results. And since delivering the training, COVID-19 has left many people with permanent lung damage that moves them into the COPD realm of care. We think we at Midmark can help more clinicians learn how to incorporate spirometry testing into their daily practices and make a positive impact for patients with COPD.
Right, thank you for sharing these details. And I think it says it all that making a positive impact for patients with COPD. That's the important part of it. All right, so now we saw that, you know, there were multiple types of learning modalities which were used in your remote learning program and how you did it. So let me pick the game-based modules for which you partnered with Harbinger Interactive Learning and ask a few questions to Darshan here and understand the thought process behind it. So Darshan, the first and foremost question that comes to our mind is as to why did we choose, you know, at the first place, a game-based design to create this learning modules for COPD and spirometry training?
Sure, Rahul. To understand why a game-based learning design was chosen, first let's understand the objectives that we were trying to achieve through this. So one, the training should help the team learn about COPD, understand its impact on the patients, and help them understand why being a solution provider for primary care is important to Midmark. Number two, the customer wants the sales team who already sells the spirometry system to become a solution provider and not just a salesperson who merely focuses on the features of the product. To meet these training goals, a gamified learning experience was created for Midmark sales professionals in the form of COPD experience modules. These experience modules take learners through common real-life situations that are faced by COPD patients. So the learners need to step into the shoes of a patient and take appropriate decisions in each situation. We have gamification elements such as scores and patient well-being indicator, which adds to the engagement level of the modules and emphasize the importance of taking appropriate decisions at right time.
Well, thank you, Darshan, for explaining this. And I think the real life situations in which the learner needs to step in these game-based learning modules sounds very intriguing.
Yes, absolutely. In fact, let me show a quick sample of the actual work that will allow us to experience this further.
Sure, Darshan, that would be great. And I think you'll have to flip your screen. So for the audience, you'll see a blank screen for a moment while Darshan is flipping the screens to bring up the sample up there.
Just dealing with the flare. This is part of a series which we've created for a day in the life of a patient with. We'll start the first volume.
Hello, and welcome to this learning game on the life of a patient with COPD. Meet John, your COPD patient avatar. In this game, you will experience some typical situations John faces in his daily life.
Okay, so I'll pause here for a few seconds. So we have John, who is a COPD patient, and John will face different situations in his daily life. And as I explained, we need to step into John's shoe to take right decisions to make sure John stays healthy. So if I were to go to the screen, we will see there's two tabs. One is more about John, which talks about John's medical history, and second about John's personal life. Then I can go to the tab 2. Which talks about the game. So the goal here is to maintain John's vitality indicator in the green zone. And the game rule is that we will experience 3 events in John's life, and we need to decide best action for each of the event. So the best decision will give us 10 points, and a not so good decision will give us 0 points. So let's look at the first scenario here.
After the diagnosis of COPD, your PCP prescribed you 2 inhalers. One to be used every morning, which you have been using faithfully, and a rescue inhaler to be used for times when you feel short of breath.
Okay, so as you can see, John has been prescribed 2 inhalers, one for daily use and one in case of emergency. So now we have a situation where John decides to clean up the house as he's expecting some guests. And while doing so, John experiences some difficulty in breathing and some tightness in his chest. So what should John do in this situation is something that we need to help him with. So if I go to the end of the screen and click on next, we will be asked a question.
You are disappointed that you can't clean your house prior to family visiting and have to decide what to do next.
So here is where we need to step into John's shoe and help him make a decision. So let's say I select the first option here and click on submit. That's the right decision and we score 10 points. With that, let's quickly look at one more scenario.
You're taking a walk around your neighborhood and notice that your neighbors are burning leaves. You continue to enjoy your walk when you start experiencing some shortness of breath.
Yeah, so that's the next situation where John is experiencing some shortness of breath and a bit of wheezing. So again, John decides to walk back to his home, and we need to help John in making a decision on what he should be doing next.
As you rest in your chair, the short.
So from this, maybe if I choose the second option here, which is go to emergency room immediately and click on submit. So that is an incorrect answer. At the same time, you get to know that what the right answer was. So I think this should give you all a flavor about how this game was designed. And the sales rep, it really helps to understand on the journey which the patient is going through.
Thank you, Darshan. This was pretty interesting sample that you showcased us. We have a couple of questions for you, and let's take those questions, and also allow me to bring up the slide deck back again. Okay, so the first question that we have for you, in fact, both the questions are similar. The first question is, what tool has been used to develop this learning module?
Well, this learning module, which we just saw, was developed in Articulate Storyline 360.
Okay, thank you. And is this mobile compatible? Can this be accessed on mobile devices?
Yes, that's correct.
All right. Okay, thank you very much, Darshan. Once again, thank you very much for showing this particular sample. And, the kind of, when you were responding to questions and the kind of instant feedback along with those points, some of those gamification elements that you're getting, they were pretty cool, kind of motivators for the learner to do better and, kind of understand the concept and grasp the knowledge. All right, so I think we looked at the sample, so and we also looked at the multiple options that Cleon and his team has used for implementing the remote learning solution. So I think Cleon, the audience would like to know in terms of what has been the outcome for this training program, and is there anything that you would like to talk with us today around the outcomes?
Sure, Rahul. I can give you some preliminary information, but it's still too early to evaluate the behavior change and the business outcomes. Those usually take at least 3 to 6 months, and the recent focus on COVID-19 has pushed that out even further. But some of our key learnings that we have so far is that no matter how short a module is, learners like to know ahead of time how much time it will take them to complete the module. We found that allowing teammates to study topics remotely per their personal schedule allowed for more focused attention. It cannot be stressed enough for the learner to understand how the topic fits into their sales goals and corporate strategies, and the learner's managers need to understand how important it is for them to proactively support the learning. So those are some of our soft skill learnings, but we also have some data from evaluations that we did with the learners. Midway through the learning, we surveyed a cross-section of our sales and marketing teammates, as you're seeing here. I know you won't understand the acronyms, but you can see that there is a wide range of people. Some of them have very little or almost nothing to do with COPD or selling spirometry products and services, but we still included them in the learning. Now, 91% of them found that Dr. Tom's overview video was very or somewhat useful. 97% found the What is COPD e-learning module very or somewhat useful. And you can see there was very little neutral, and not so useful was empty. And then we also did an evaluation on the day in the life gamification module, and you'll see here that 91% found this module very or somewhat useful. Now, no one found any of the above not useful, even though they may not be involved with spirometry. And what was especially interesting is that the videos and e-learning modules were rated higher than the actual hands-on spirometry workshop that we did at the summit. That only received an 80% useful score.
Right, thank you very much, Cleon, for sharing this data with us and some of the initial learnings and the outcomes. These are some pretty interesting numbers. And I think the last one, the fact that the hands-on spirometry training received relatively less approval as compared to some of the other remote learning modalities, like Dr. Tom's video, the e-learning modules, and the gamification modules, speaks about how remote learning, if planned and structured well, can get us the desired business results. Right, so with that, having said that, Cleon, Darshan, thank you very much for this wonderful conversation and sharing these insights as to how remote learning can drive organizational change initiatives. So, we spoke about the change that Cleon and his team were trying to drive at Midmark Corporation. To drive this change, they implemented a learning solution. Some of that learning solution was designed for remote learning, and some of it, because it was done in the pre-pandemic situation, was in person, like the in-person Dr. Tom's presentation to the audience in person. But Cleon also kind of walked us through in terms of if they had to be done in the remote learning scenario, how we could do that. And then we saw that how we can, bring in the desired, meet the desired business objectives and bring in certain behavioral changes through some of these remote learning modalities like the game-based learning module, wherein a learner experiences, as to how a COPD patient feels, just to be in their shoes, so that they can understand and relate the topic, and then they are able to have more meaningful conversations and can add to the desired to meet and can add value to meet the desired goals and business objectives. So once again, Cleon, thank you very much for taking the time out for this session.
You're welcome.
Right, so now I think now is the time for us to open up for the Q&A session, or rather we should say discussion session. So please feel free to type in your your questions, thoughts, comments in the Q&A section or in the chat box. And with that, also let me take an opportunity to say thank you to Darshan. Darshan, thank you so much for sharing those insights and especially walking us through that sample. That was pretty interesting.
Oh, you're welcome, Rahul.
Right, so we are scouting for the questions here while we, we'll take up the questions one by one, and I will be assisted by my colleague Isha to handle the question flow.
So Rahul, Darshan and Cleon, we see a couple of questions coming in. I think this one goes for Darshan. It talks about the sample and asks, can we call this sample an example of scenario-based learning?
Well, yes, you can call it as a scenario-based learning. Plus, since we also had included some game-based learning elements like the point systems and the meter, so I think it's a combination of both.
Thanks, Darshan. And the next one, I suppose it goes for Cleon. The question says, how much time did it take to implement this remote learning strategy, right from conceptualizing it to actually rolling it out to the end users?
Well, I'll answer it in two ways. The overall project with all of the components we did within 60 days, and the individual game modules, once we had the idea of what we wanted to deliver and we worked with Harbinger, we were able to do those modules on an average of about 2 weeks each.
Thanks, Leon. There's another one for you which says, can you throw some more light on how remote learning solutions can help to achieve better patient outcomes?
Yeah, so that's an interesting question because it may not be readily evident to many people. As Midmark, we, as I said, are primarily known by the equipment and devices that we make, but it's really how people use them, such as the clinicians, and how patient outcomes are improved by using the devices. So that was what we really were focusing on, is helping our salespeople understand the clinical side and the patient side of how the equipment is used, to have the discussions with the clinicians in the office and the hospitals on how to implement those devices in their workflow. So for instance, many people think spirometry takes 25, 30 minutes for a test with a patient. And that is not necessarily true at all. We have been able to get those down to under 5 minutes. So a doctor who is really looking at how do I get this through my workflow, understanding who can actually use the equipment, conduct the tests, and fit it into their workflow without having to spend a lot of time. And that also helps that patient get their tests quicker, because if a doctor refers the patient to a specialist, many of those patients will never go get the testing at the specialist. So if we can do it at the initial point of care, we believe there are better patient outcomes.
Thanks, Leon. That was helpful. There's another one for you which says, what tools and systems were the part of your learning environment?
So we are implementing Salesforce across our company. So our learning platform is Opinium, which there are many learning platforms in the marketplace. So that is what we have posted it on, and it's part of the Salesforce platform access from our sales teammates.
All right, and the next one, perhaps you and Darshan can decide who will take this up. How did you select these learning modalities? And there's another one which perhaps can add up to this. Was the completion rate of one modality better than the other?
Yes. So to both of those questions, how did we decide upon the modalities? We looked at the content that was to be delivered and figured out what was the best format to deliver that in. So for instance, the video, the overview video from Dr. Tom, that was something that can be used multiple times. It can be used when you have a new onboarding employee as well. So we use that first, and that's the module that actually got the most viewing and use, because as I said, many of the people did not have anything really to do from a sales perspective with COPD or spirometry, but yet they were able to watch the video, learn about why it was important to the company, and then they could call upon the specialists in their teams that would be able to answer more in-depth questions.
Thanks, Cleon. There's another one which perhaps I'll take up. This asks, will you share the slides from this web meeting with us, all the attendees? So yeah, we will do that shortly. And Darshan, perhaps the next one is for you. It's a very interesting question and asks, which instructional design courses has your team undergone?
So I think the team has taken multiple kind of ID courses, and we mainly follow the Bloom's taxonomy, for all the work that we do.
All right. I think in interest of time, we shall be answering the rest of questions via email. And thank you, Rahul, Darshan, Cleon, for taking us through this wonderful session. Over to you, Rahul, to close it.
Thank you very much, Isha, for moderating the questions. And thank you very much, Cleon, Darshan, for answering those questions for us. Right, so, okay. So once again, thank you everyone for taking the time out for this webinar. It was, we hope you enjoyed this. This was wonderful. Cleon, once again, thank you very much for your time today.
You're welcome.
Darshan, thank you. Thank you so much for showing up for this event.
You're welcome, Rahul.
All right, so for our audience, thank you very much once again for actively participating in the event with your questions and with your comments, participating in the audience poll. We hope you enjoyed it. If you have any questions, any follow-up questions for Cleon, Darshan, please do write to us. If you want to talk about something very specific, you can drop us a line at info@harbingerlearning.com. I'll repeat, it's info@harbingerlearning.com. We'll just hang out on this web link for a few more minutes, just to see if anyone has any comments or anything to type in. So thank you very much for showing up for today's event. We hope you enjoyed this. Have a good one. Bye-bye.